The idea to dedicate this year's conference to the topic of epilepsy is related to the frequency of epilepsy in the general population. We know that 3–4% of the population suffers during his lifetime of an epileptic attack, and 1–3% of the population presents recurrent attacks and therefore the epileptic syndrome. Epilepsy is important not only because of its frequency, but because of its consequences, the need for a chronic treatment, the potential risk of side effects of the medication, the knowledge that epilepsy treatment is not always effective. So we know that up to 1/3 of the patients cannot be well controlled with antiepileptics. And also the risk, the rare but still existing risk of very severe consequences, including sudden death following epileptic seizures. Now, the idea is not only to talk about the problems related to epilepsy, but also the possibilities, the advances in our understanding about the etiology of epilepsy, how seizures arise in the brain, about the possibility to make today a very precise diagnosis when and where the epilepsy is taking place in the brain, and the treatment that can be used with a number of antiepileptic drugs that is increasing, and we do have now a broad choice of antiepileptic drugs. And finally, also, this was one of the very important messages of tonight, the possibilities of treating epilepsy with a surgical intervention, functional neurosurgery. This is certainly methods that must be reserved for a minority of patients, but one of the messages today was to think about surgery of epilepsy not too late, but to choose and think about it earlier than it is done now in most places in the world.